Assalamu alaikum. So in this video we will talk about acute lymphoblastic leukemia. What is acute lymphoblastic leukemia? Leukemia is actually, as we have said already in our previous video, that leukemia it is said to be leukemia when there is increased number of white blood cells in the blood. Now that leukemia can be acute and chronic. In the acute, it can be of two types. It can be acute lymphoblastic leukemia and acute myeloid leukemia. We are not going to discuss acute myeloid leukemia. We will basically keep it for another video. In this lecture we will discuss acute lymphoblastic leukemia. Now what does acute means? Acute means that the symptoms will be very rapid in onset, will be progressive in nature. Lymphoblast means that there will be immature cells present in the blood as well as in the bone marrow. The blasts will be comprising of more than 20% in the bone marrow, and that will disrupt the normal hematopoiesis going on, due to which there will be anemia, there will be bleeding, and there will be infection, right? Now there will be the presence of large blast cells, immature cells in the blood. How will we know that whether it's a lymphoblast or a myeloid in origin? So the lymphoblast, we have a test, and that test is actually tDt positive test. Now tDt is a DNA polymerase. When the test comes positive, we say that it's acute lymphoblastic leukemia. Now acute lymphoblastic leukemia is of two types. One is the BALL and the other one is TALL, right? One is the B acute lymphoblastic leukemia and one is the T acute lymphoblastic leukemia. Now the BLL is more common than TLL, and BLL usually occurs in children and TLL usually occurs in teenagers, and it is present as a thymic mass. Now of course there are certain markers, cell markers, by which we know that whether it is TLL and BLL. For TLL we have CD2, CD3, CD4, 5 and so on till 9. No CD10 and so on. These surface markers are present on the TALL, and the surface markers present on the BLL are actually CD10, CD19 and CD20, right? This we have to know. The prognosis basically depends on the cytogenic abnormalities. If the translocation is of translocation chromosome 12 and 21, the prognosis is very good. I'm talking about BALL. The prognosis is very good, whereas if the translocation occurs in chromosome 9 and 22, then the prognosis is poor, right? Now in these lymphoblasts, the tDt, which is the DNA polymerase, will be positive, right? Whereas in myeloid and in the lymphocyte, which is the mature form, it doesn't have this tDt positive enzyme. This tDt is only positive in lymphoblast. So that is how we will know that whether the blast present in the blood is lymphoblast or myeloid. And to differentiate between BALL and TALL, we have certain markers. Of course, in TALL there will be a thymic mass present, and it mostly occurs in teenagers, and the markers are CD2 to CD9. Whereas in BLL, it usually occurs in children, and it usually arises in children who have Down syndrome after the age of 5. Down syndrome after the age of 5 years. BLL is more common. And of course, if the translocation occurs between chromosome 12 and 21, the prognosis is very good. Whereas if translocation occurs between chromosome 9 and 22, the prognosis is very poor. So that is all for